Wait, don't scroll past this video. Did you know your liver could be 70 to 80% damaged right now before it even whispers a single warning sign? What if I told you that you could uncover the absolute truth about your liver health right now in just 20 seconds without leaving your house? Hi everyone, I'm Dr. Monika. Don't skip this video because today I'm going to share 4 tests you can do at home right this second in just 20 seconds. These tests will reveal the hidden truth about your liver. No needles, no lab machines, just using your own 2 hands. Your liver is that one tough friend who never complains, even when it's hurting. It doesn't give you any signals until it is 70 to 80% damaged, and by the time you finally find out, it's often too late. That's exactly why you need to know the 4 tests I'm sharing today. You need to be able to check in on your liver from time to time to see how it's really doing. If you pass just 3 out of these 4 tests, you can consider your liver young and healthy. But if you pass fewer than 2, take it as a massive wake-up call. And hey, make sure to remember your score after each test, because at the very end of this video, I'm going to ask you to drop your score in the comments so I can see exactly what condition your liver is in. Friends, our modern American lifestyle, eating out, loading up on sugar and deep-fried foods, and staying up late, has made fatty liver a household issue. And like I mentioned at the start, there are 0 early symptoms, so don't wait for a disease to strike. These 4 quick tests will tell you today if your liver needs some extra care. Plus, stick around until the end, because I'll share 3 simple natural habits that detox your liver from the inside out and help keep it in peak condition. Test 1. The rib press. The touch test. The first test is the rib press. Literally feeling your liver to ask how it's doing. Let's do it together. Take 2 or 3 fingers and press firmly inward and slightly upward, right under your lowest rib on the right side of your body. Take a deep breath in through your nose and gently press your fingers a bit deeper. As you inhale, your liver naturally moves down a bit toward your fingers. Pay close attention. Do you feel any pain? Is there a sense of heaviness or tightness? Can you easily feel or touch your liver? Does everything feel normal, or is there some discomfort? Are you noticing any irregular masses, nodules, or lumps? If you don't feel any of those things, that is fantastic news. You passed this test. However, if you feel a slight pain, heaviness, tightness, or if your liver drops down significantly and is very easy to feel, it means your liver might be swollen or enlarged due to an underlying condition. That's why it's touching your fingers so easily when you breathe in. Pain means there is inflammation, an underlying issue, or tissue injury. This is a red flag that something is internally wrong with your liver. If you failed this test, meaning you feel pain, swelling, or heaviness, don't just sit on it. You need to be proactive. Go to your doctor immediately and ask for a liver panel so you can get a clear picture and catch any potential disease early. Test 2. The wall sit. This second test involves your legs. You're probably thinking, Dr. Monika, what do my legs have to do with my liver? Actually, they have a massive connection. Listen closely. Find a wall and lean your back flat against it. Slide down into a seated position, exactly like you're sitting in an invisible chair. Keep your back flat against the wall and your knees bent at a 90-degree angle. Hold this position for 20 seconds. If your legs start burning or shaking uncontrollably, if you're struggling hard, or if you have to stand up after just 15 seconds because you can't take it, it's a sign your liver might be getting weak. But if you easily crush those 20 seconds, great job, you passed. So what's the connection? Everything we eat is converted into glucose by the body. The biggest consumers of this glucose are our muscles, especially the large muscles in our legs and calves. When these muscles are weak, they stop absorbing that glucose efficiently. That extra glucose then travels to your liver, which turns it straight into fat and stores it around itself. This is exactly how you develop a fatty liver. Research actually shows that people with low muscle mass are at a much higher risk for insulin resistance and fatty liver. Simply put, weak legs are an open invitation to fatty liver, but don't panic. This is fixable. I'll tell you how at the end of the video. By the way, if you're finding value in this video and learning something new, please hit that like button. Support the channel so this information can reach more people, and it gives me the motivation to keep creating premium health content for you. Test 3. The eye and tongue check. The eye and tongue. For this third test, you don't have to put your body through any physical strain. Just go stand in front of a mirror and look at your eyes and tongue. First, look closely at the whites of your eyes. Is there a slight yellow tint? Not necessarily deep yellow, but even a dull, muddy yellowish hue. Next, stick your tongue out. Look closely. Is there a thick white or pale yellow coating sitting on top of it? If the whites of your eyes are crystal clear and your tongue is a clean, healthy pink, you passed. Your liver is doing its job perfectly. But if there's yellowing in your eyes, it means bilirubin levels are rising in your body. It's your liver's job to filter out bilirubin, and when the liver is sick, that bilirubin starts depositing in your eyes and skin. A thick white coating on your tongue is what Ayurvedic medicine refers to as ama, a heavy buildup of toxins. Both of these are massive signs of liver disease. Keep in mind, yellowing of the eyes is a somewhat late signal of liver distress. So if you see this, do not take it lightly. Please go get checked by a doctor immediately. Test 4, the stomach vacuum. All right, 3 tests down, but we are not done yet. This final test is the most important one, and doing it will reveal the absolute truth about your body. Stand up straight, exhale, and pull your stomach in as hard as you can, just like you do when you're trying to zip up a really tight pair of jeans. Keep taking shallow breaths, but hold that stomach pulled in tight for 20 seconds. Does your stomach violently jerk back out right away? Are you unable to hold it in for the full 20 seconds? Or is your belly so hard and stiff that it won't even pull in to begin with? If you can easily pull your stomach in and hold it there, you passed. But if you struggled with this, it's a strong indicator that you are accumulating visceral fat. Visceral fat isn't the soft, pinchable fat just right under your skin. It's the dangerous, hard fat that wraps directly around your liver, pancreas, and intestines. This is the exact fat that drives non-alcoholic fatty liver disease. It creates insulin resistance in the body and plays a major role in skyrocketing your risk for heart disease. If you failed this test, it means your visceral fat is increasing and your chances of having a fatty liver are incredibly high. In this case, you definitely need to see a doctor and get a liver function test, LFT. You should also check out my other videos specifically on visceral fat, where I break down highly important tips on how to lose it. 3 habits to regenerate your liver. Everyone, if you passed all 4 tests, congratulations. Your liver is in fantastic shape. But if you failed a few, don't panic. The liver is the only organ in the human body that can completely regenerate and rebuild itself. You just need to adopt the right habits. Habit 1. Drink warm water on an empty stomach. First thing in the morning, sip on 2 glasses of warm water. You can squeeze half a lemon in there or just drink it plain. This is the easiest, cheapest, and most effective way to detox your liver every morning. Your liver works all night gathering up toxins, and this water flushes them right out of your system. Habit 2. Brisk walk for 20 minutes, 5 days a week. Remember test number 2, where we talked about leg strength? This habit builds that exact strength. When you power walk, your leg muscles absorb that extra circulating glucose. This dramatically improves your insulin sensitivity and takes the fat-storing burden right off your liver. Aim for at least 20 minutes daily at a brisk pace. Habit 3. Cut the sugar and fried foods. Yes, you heard me right. The liver's biggest enemy isn't actually alcohol. It's sugar, specifically refined sugar and fructose. When you eat too much sugar, the liver directly converts it into fat. Cut out refined sugars and deep-fried foods, especially those cooked in highly processed seed oils, as much as humanly possible, or eliminate them entirely. Important disclaimers. Please remember that these 4 tests are just meant to make you alert and aware of your liver health. They are absolutely not a replacement for a clinical blood test, ultrasound, or FibroScan. Take these as warning signs, not a final medical diagnosis. If you have persistent yellowing in your eyes/skin, get an LFT immediately. If you have sharp, continuous pain under your right rib or in your abdomen, do not try to diagnose it at home. See a doctor. Do not attempt the wall sit or the stomach vacuum if you are pregnant, have high blood pressure, or suffer from severe back or knee issues. And if you already have a diagnosed liver condition like hepatitis, or if you are on medication, always consult your physician before starting any new routine. All right, everyone, be honest. Out of these 4 tests, how many did you pass? Tell me down in the comments. Write 1, 2, 3, or 4. I am personally going to read through your comments to see who has the healthiest liver. If you found this information valuable, please share this video with your family and friends. Hit the like button, and if you're new here, make sure to subscribe. I'm Dr. Monika, and I'll see you in the next video. Until then, take care of yourself, keep smiling, and keep learning something new every day so you can stay healthy forever.